Hello everyone and welcome to the webinar. In today's webinar we're going to take a look at data security from a healthcare, ePHI, and HIPAA compliance perspective and provide insight and strategies to stop insider data breaches and other serious data security threats in your organization, especially in regards to endpoints and data leak prevention. I know that everyone's time is important, so we'll be going through some of this information pretty quickly to keep the webinar under 30 minutes so that you can get back to your important jobs. Introductions. My name is David Mathieson, and I am the Director of Strategic Account here at DeviceLock. Just to give you a little background on myself, I've been involved in the network, application, data, and endpoint security areas for over 25 years, and I've co-founded and managed data security-focused companies prior to my position here at DeviceLock. All right. Now that we have the agenda up, here's a quick look at that. I'll start by giving a very brief company background of DeviceLock for the people who aren't quite familiar with us. And then we'll take a brief look at HIPAA from a data breach perspective. And then I'll talk a little bit about the insider and endpoint threats that can affect your HIPAA compliance situation, how DeviceLock data leak prevention can help ensure HIPAA compliance, and then I'll give a brief overview of the methodology for deploying DLP in a healthcare environment. And then hopefully we'll have a short time for some Q&A as well. And I'll conclude with providing our contact details for anyone who'd like further information about DeviceLock. Before we start, I'd like to point out in the GoToWebinar panel on the right of your screen, there's a place where you should be able to type in your questions during the webinar. So I'd like to encourage anyone to post questions during the webinar, and once we get to the Q&A session, I'll try to get to those and answer those live. But if we run out of time, I'll go ahead and log those and answer the questions directly via email. So to give you a little background on our company, what has been known as DeviceLock Incorporated for about the last 9 years was actually established way back in 1995. It's been providing the DeviceLock named software commercially since 1996 and is a privately held company. So yes, we've been out there for 20 years. DeviceLock Inc. in the Americas is actually headquartered in San Ramon, California, and we have affiliate offices in Vancouver, British Columbia, and all over Europe. We started out as the true pioneer in the Windows endpoint device and port control space, and really over time have evolved into a more mature space of endpoint data leak prevention and also DLP discovery and remediation for data at rest. DeviceLock is a world leader in endpoint device and port control with over 70,000 unique customers who deployed our products in well over 7 million endpoints. And as you can see, we're a multi-award winning solution as several leading data and PC security publications over the years. DeviceLock scales very well, as evident by our largest deployment to date of over 80,000 endpoints in one organization. All right, so I want to give a brief overview of HIPAA, which I'm sure everyone on the call is somewhat familiar, especially if you're in the healthcare industry. The Health Insurance Portability and Accountability Act of 1996 was enacted by Congress to protect sensitive patient data. The act contains a, quote, privacy rule and another, quote, security rule, which established kind of national standards for how companies working with patient data must ensure the data's confidentiality, availability, and integrity. Another one, the Health Information Technology for Economic and Clinical Health, or HITECH Act of 2009, brought a major update to the HIPAA security rule that more clearly defined the guidelines for proper interaction with health information, expanded the liabilities of companies subject to oversight, and certainly increased fines for non-compliance, and then enabled more stringent enforcement. According to HIPAA privacy and security rules, compliance is required of both covered entities, your typical hospital healthcare provider, and also their business associates, and both have an obligation to keep that data very secure. An update to HIPAA, known as the Omnibus Rule, was adopted in early 2013 and includes some major changes, including increased direct liability for business associates and their subcontractors, as well as a tiered penalty structure for non-compliance. So penalties for non-compliance vary based on violation, but they range between $100 and $1.5 million with criminal penalties of up to 10 years in prison. So definitely nothing to sneeze at. So we'll talk briefly about the privacy rules here. And the actual security rule is the rule that we're most concerned with for the purposes of this webinar, and it specifically identifies required policies for ensuring the safety of sensitive patient data. Security rule requires that covered entities to implement administrative, technical, and physical safeguards that are necessary for protecting ePHI, or patient health information, in electronic form. These include identifying potential threats and protect against anticipated threats to the security or integrity of ePHI, protecting against reasonably anticipated impermissible uses or disclosures of patient data, and ensuring compliance from their workforce, including subcontractors. But here's the problem, which is kind of typical of government compliance initiatives. The HIPAA, high-tech, and omnibus rules certainly tell you what you need to do and explains what the consequences of not doing that are, but they really do not tell you how to actually achieve compliance for either one. What you need to do in order to achieve HIPAA compliance is really up to the covered entity or business associate to pretty much figure it out. So the goal of this webinar is to provide you with some insight into one of the more important security threats to ePHI data and to offer a solution to solve that problem. So even though HIPAA has been around for a while and that compliance has been on everyone's minds in the industry for quite some time, there are still weekly data breaches being reported. And according to numerous studies, including from PricewaterhouseCoopers and the Ponemon Institute, 2015 was yet another year of massive data breaches with an increase of 193 reported incidents from 2014's total. So here are just a few, I mean, you can see your screen here, so a few major data breaches last year in the healthcare industry. I'll let you read those on your own. But if you focus in a little bit, the Anthem breach alone is estimated to be costing the company between $8 billion and $16 billion in fines and remediation to fix. But nothing can really fix that reputation once that occurs. With the average cost of lost or stolen data record being somewhere around $363 for healthcare companies, this is considerably more costly than for other kinds of data breaches. So as you can see, there are significant consequences to non-compliance, including fines, lawsuits, hits to reputation, hits to the share price if you're a public company, thousands of hours of IT and administration resource time in cleaning up the mess, hiring new IT staff, and often some of the former IT staff get fired as scapegoats. And this is really probably a good segue into digging deeper into data breach incidents themselves. So when you look at the root cause of data breach incidents, you'll find that a vast majority, 63% in fact, are caused by insiders. Okay? And of those, 57% are caused by unintentional mistakes by trusted authorized users. They were simply, because controls weren't in place, accidents happened. Although the malicious external hacking incidents sure get a lot of the front page news, the greatest cause of data breach incidents in any organization, including healthcare, is via their trusted employees, who are normally conscientious, loyal, but also prone to the most basic of human characteristics, and that's making simple data handling mistakes. Companies are more likely to focus on the outsider threat, and this can be easily shown by how they spend their money on data security, where upwards of 80% of budgets are typically focused on perimeter defenses to keep out the malicious hackers on the outside. They spend most of the resources to create this hard outside shell, but they forget that inside there's now this soft GUI center of non-protection. It's important to make clear that we're not implying that your employees or contractors are bad guys. Far from it. It's really just that according to Ponemon Institute and other analysts that we've researched, the majority of data breach incidents are caused by what we call trusted insiders. And again, most of those breaches are a result of some sort of unintentional mistake. So again, are we really looking to spend our time and resources guarding against the Darth Vader looking guy on the left? As the data shows, it's really the nice lady on the right that we have to be careful about, since Millie the billings bookkeeper or Bob the hospital administration clerk really are the general causes of the majority of data breaches that tend to occur in a healthcare organization. And when we dig a little bit deeper, it's very important to note that when we look at launch points for insider data breaches, 56% are from computer endpoints, with mobile devices only at 42 and the network only at 43. So let that sink in a little bit. Endpoints are the main launch point for insider attacks or accidental data breaches, and hence the focus of our webinar is on endpoints, since that's where the majority of attacks take place and where your HIPAA compliance is most easily compromised. So as we discussed previously, HIPAA does not provide guidelines on how an organization must protect itself from noncompliance. But since we know that the majority of data breaches happen from insider threats and the launch point is mostly from computer endpoints, then it's imperative that healthcare organizations take a long look at security strategies that have developed and the technology solutions that they have actually deployed. If you are specifically lacking in endpoint security, and since it's a known cause of data breaches, then to remain compliant and protected, endpoint data leak prevention can be a critical area to address. And just a case in point, in the short survey we did as part of the registration process for this webinar, we could tell you that roughly 70% of the registrants were not using endpoint data leak prevention solutions. 15% weren't quite sure, and another 15% were actually currently using DLP, with most of those using DeviceLock. So thank you. And it's really not like, obviously, with all the HIPAA information out there and the focus on data breaches. It's not like CIOs and CISOs are not aware of the threat. In a recent study of 1,000 plus CIOs and CISOs, 64% feel that they are at least moderately vulnerable to insider threats. So certainly some level of awareness is there, but they're not addressing the problem. Further evidence of that, when you look at their response where they have actual tools in place to combat insider threats, less than half say they do. So there is awareness, but really no tools or controls in place for most organizations. So how do you stop the root cause of most data breach incidents? Well, a lot of companies focused on policies and training, all very good. However, policies can be misinterpreted, maybe too complex, or even counterproductive to a company's or an employee's normal business practices, and certainly sometimes productivity. Common result is that data security policies are only loosely followed or even intentionally ignored, or just too confusing to the point that employees do not know how to do their jobs without actually breaking the policy. In fact, employee workarounds to data security policy happen so often that security professionals are given a name called shadow IT. Shadow IT occurs when employees circumvent their employer's established security measures through unapproved practices and maybe even some software. A diligent hospital employee may plan to work late to finish a time-sensitive project and send a spreadsheet containing personal health information to his personal iCloud account. While the intentions might have been good, the consequence could be disastrous if the data is then lost or stolen. So as you can see, reality is that written data security policy without a technology-based monitoring enforcement solution in place is certainly doomed to fail. And that's really where DeviceLock DLP comes in. We focus on the endpoints where the most frequent, inadvertent, and malicious data breaches occur, and then provide easy-to-deploy and configure software solutions that tackle the problem at the typical source of the breach, the employee's PC endpoint. Most importantly, we've been doing it for over 20 years, for over 70,000 unique customers across the world on over 7 million endpoints. All right, so with that in mind, let's take a look at some of the additional threats to HIPAA compliance. Most everyone in the IT security industry now, knows that the DLP solutions are generally for protecting intellectual property assets and aiding in regulatory compliance like HIPAA. But what's really driving a great deal of excitement around the market for DLP today is a tremendous growth of mobile devices in the workplace. The idea of the bring your own device, or BYOD, has really been taking off the last several years. And this usually refers to personal smartphones like iPhones, Androids, Blackberries, etc. There are many other mobile devices which pose a threat for data leakage. Things like iPods, iPads, other MP3 players, USB sticks, of course, small little SD RAM or compact flash, digital cameras, and many more. All of these devices can be easily concealed in a pocket, briefcase, or backpack. It is impractical and intrusive to really search employees for these items in all but the highest security facilities. Once someone is inside your building with one of these devices, it's pretty trivial to dock that device to an endpoint laptop or desktop and then drag information across from your network or the local hard drive, and then whatever they have access to from their account. I mean, if you look at it, most iPhones today at least have 32 gig of storage. That's big enough to fit the healthcare records of even the largest provider, plus room for just about any other data that someone might want to steal. So all of this has healthcare IT execs very concerned. They can no longer get away with just the just say no approach, really, to mobile devices or bring your own devices. It used to be you could just issue a company phone that was locked down and forbid any type of data extraction, but this is becoming expensive and virtually impossible. So IT execs have to find a way to enable these mobile devices in a secure way. Kind of in confluence with that, at the same time the bring your own device craze is giving IT execs heartburn. They're coming under more and more pressure to move more of their IT infrastructure and applications out into the cloud. So the cloud and the internet in general present a whole host of other data leak threats. No matter how much infrastructure IT execs push out to the cloud, they still have to protect the endpoints that employees use to access the cloud and the internet in general. In the end, there's still no getting away from the need to protect user endpoints from leaking sensitive information out of the organization, whether that information is coming out of corporate networks, through peripheral devices, or out to the cloud. We're going to talk now about how DeviceLock can provide a solution, even to the point of helping IT execs know what kind of information is inside files that employees are moving off to USB sticks, etc. So let's take a look a little bit more closely at DeviceLock. DeviceLock's Endpoint DLP Suite is a software offering that provides protection against local data leaks on Windows or Mac endpoints via a wide array of peripheral threat vectors. These include iPhones, Androids, BlackBerry, other smartphones, MP3 players, Wi-Fi, Bluetooth, FireWire, etc., CD, DVD, optical, anything you could think of that you could plug into a Windows or Mac device. The product is a software-only solution. You don't have to worry about building another server somewhere or buying some sort of expensive appliance that needs to fit into a rack and take up power or cooling inside your organization. Our software is small, low-overhead DLP agent that runs on the endpoint, and that is typically managed centrally by the eminently scalable Microsoft Active Directory group policy. And we do that through group policy objects, or GPOs. Okay, so we can get a little more deeper in how does DeviceLock software actually work. Okay, just give you a bit of background on how the solution works and how it's structured. The suite consists of 3 distinct software modules. The first is DeviceLock Core itself, which is our original product that first released commercially 20 years ago. So this is a very mature, well-established, market-leading product with over 7 million devices protected worldwide so far. It's now on the version 8 series, so it's very well vetted. It's used in classified military environments and has garnished dozens of endpoint security and DLP awards. DeviceLock Core provides the platform capabilities and is the basic building block on which the other 2 modules optionally integrate. DeviceLock resides in the kernel, and as such can contextually secure peripheral ports and devices, whether they're on the PC bus or that mount via plug-and-play ports. You can do this for both the Windows and the Macintosh platform. For Windows, it also resides in the print spooler and therefore handles all printing to locally attached printers and to network printers. It also provides hardware keylogger detection and blocking and is the base engine for all auditing, shadowing, and alerting in the full product suite. Similarly, NetworkLock provides contextual control capabilities to IP protocols, and this addresses the network-related threat vectors endpoints face, like company email, personal webmails, instant messengers, social networks, cloud services, FTP, torrents, SMB shares, etc. And the third module, ContentLock, plugs into both the DeviceLock Core and NetworkLock modules for Windows and can look inside files and sessions to inspect content for sensitive information like social security numbers, credit card numbers, keywords like the HIPAA ICD-10 terms. I think we're the first solution that has compatibility and templates for ICD-10. Document properties, other admin definable information. If you happen to be an Oracle shop with using the IRM solution, we can leverage that. And any combination of rule types for allowing, blocking, or shadowing data transactions. ContentLock can also employ on-the-fly optical character recognition, or OCR, in over 30 languages to discover sensitive data that might otherwise be hiding in file scans, image files, PDFs, etc. Incidentally, we also have a discovery piece that enables you to gain content-aware visibility, remediation, and control over sensitive data at rest. So that's data that's stored across the network on Windows-based servers, endpoints, or SMB-compatible storage to proactively prevent potential breaches of sensitive data through several remediation methods. And I'll talk a little bit more about that on the next slide. As mentioned, DeviceLock Discovery is a separate DeviceLock DLP module that enables our customers to gain visibility and control over confidential data at rest stored across their IT environment in order to proactively prevent data breaches and achieve compliance with regulatory and corporate data security requirements. This is a tool that's very important for HIPAA compliance, as you'll be able to use Discovery to search your entire Windows network, including all of your endpoints, to identify if there's any ePHI data residing there. To start, you can search for a combination of social security number, insurance number, or medical record number, if that's identifiable. And then as you go deeper, you can search for HIPAA-specific keywords to discover places where ePHI data is being stored. When a file with exposed sensitive content has been discovered, a set of automatic remediation actions can be enforced, including things like deleting, safe delete, deleting the entire container. You can also set NTFS file permissions to take ownership away from the current owner, or you can audit, log, alert, or notify the user, as well as encrypt the file if Microsoft EFS is present. So with all that being said, we're often asked what steps should be taken deploying a DLP solution in an organization, and here are some guidelines to help you. The first step is to identify the patient data to be controlled. For healthcare organizations, scanning for simple combinations of social security numbers or medical record numbers is recommended as a starting data set to use. This set of data will serve as a good marker for identifying PHI records in a scanned target. You can also go further and search for any HIPAA ICD-10 terms that accompany medical record numbers or social security numbers. The second step is to identify potential places where the information may leak. At this point, you're You're identifying endpoint peripheral ports and attached devices, as well as network protocols and applications like web forms, cloud file sharing sites, social media, email of all kinds, instant messengers, and other endpoint data egress points. Printing is also a huge concern. The next step is to scan all of the data at rest stores for protected information residing where it's supposed to be or isn't supposed to be, and have a plan for remediation steps based on what is found and where. The final step to implement controls, which can mean involving ePHI data from locations where controls are inadequate, limiting user access to data, locking down endpoints where ePHI is handled, and block ePHI data from leaving the organization through common egress points. It may look like a daunting task, but fortunately our DeviceLock DLP solution can help in every step of that process and provide a level of control that you need in order to help prevent data leaks before they happen and checkbox these steps towards being HIPAA compliant. All right, so that's it for the formal part of the presentation. We still have a little time for questions. I can see we've had some coming in during the webinar. So let's take a look. Here's one question. Hospitals are being hit with ransomware. Can DeviceLock prevent ransomware or other malware from entering our hospital network? Okay. Well, really, the first line of defense against ransomware attacks is going to your antivirus software and hopefully good policies around opening attachments, clicking on suspicious links, etc. We don't provide antivirus software. But in terms of other ways that ransomware or other malware can enter a healthcare organization, a lot of times they're brought in on a USB drive that's plugged into a port on the endpoint. DeviceLock definitely helps with that situation. So we're able to restrict the not only the USB devices themselves and only the ones that are authorized, but we could also restrict the types of files that could be copied from the device to the endpoint computer. So, for example, we can maybe allow MP3 files or GIF files to be accessed, but block any kind of executable from being copied over or even accessed at all. So DeviceLock is not specifically designed to prevent malware, but its features and functionality actually do help plug in other of the holes in the data security environment where malware typically can find its way in your organization. Hopefully that answers that one adequately. Let's see. Let's go to another one. Okay, our healthcare organization has 5,000 users. How do you manage and administer DeviceLock in an organization of our size? Well, great. DeviceLock is designed specifically for Windows Active Directory admins to configure, deploy, and maintain with the lightest architecture possible. DeviceLock is typically employed and managed through Active Directory group policy GPOs. The Windows admins are completely comfortable using as they've been trained to do that for their entire career. And you can use these for not only endpoint policy settings, but also pushing out software initially and through upgrades as well. DeviceLock consoles operate wherever you normally manage AD group policy, and the optional server-based audit collection functions can piggyback on existing servers that have open capacity for connections during the day. And all they really do is aggregate audit and shadow records from the endpoints back to a central reporting repository, and then you can do additional forensic analysis there. Hopefully I answered that. Plus, if you've noticed earlier, our largest deployment is up to 80,000 seats, so 5,000 certainly is something we can take care of. I'll move on to another question. We have a combination of Macs and PCs. Does DeviceLock manage Macs and other devices besides Windows? Okay, well, I did mention that we do cover both Windows and Mac. So we have our basic DeviceLock Core peripheral port and device control for Windows and the Mac platform. For instance, if anybody saw our Mr. Robot webinar we did a month or so ago, a lot of those hacks against Mac computers, we would have controlled all of those as well as in Windows. But to be perfectly clear, as far as network IP protocol and content level inspection, we don't currently do that for the Mac platform, only the Windows platform. So let's see here. You said other devices besides Windows. Okay, if you're referring to other devices like phones or tablets or things like that, we don't control what they can do, except when they're locally connected to a DeviceLock managed Windows PC as a peripheral device attempting maybe sync data locally. We actually have a couple patents in that area for iOS devices and others. But if these tablets or phones are used as independent endpoints themselves, we can manage those devices non-natively, really only if they're using a virtualized RDP or ICA service like Citrix Desktop or Zen Desktop or VMware View or similar terminal services type solutions to remotely access their corporate applications and data like through a VPN. So while you're in that virtualized Windows session with DeviceLock in place on the server side this time, that's hosting the Windows session, we can control many DLP aspects with the shared clipboard, map drives, and other similar use cases. So we actually have a term for this. We actually call this virtual DLP or VDLP. We have a whole section of our website devoted to that. Okay, I don't see any additional questions, so we've also come to the end of our webinar time. I'd like to thank everyone that took time to attend. We value your time, so I hope we presented some useful information to you as you work to create a secure data environment in your organization and achieve your HIPAA compliance goals. If you had asked a question and we didn't get to during the Q&A session, I'll definitely send you a direct email with the answer. Also, we'll be posting the on-demand video version of this webinar on our YouTube channel in a few days. So we'll provide you the link to in a follow-up email where you can view it again or forward it to a colleague to view. But if you have any more questions that you might come up with later regarding DeviceLock or DLP in general, or certainly our award-winning DLP solution, just fire them off to me through email. You can send it to us.sales@devicelock.com, or you can always call me directly at 925-231-0041. And if you'd like to trial the DeviceLock solution, we have a free 30-day trial on our website. But that's all the time we have. Thanks again for attending. We look forward to seeing you at a future DeviceLock event or webinar.